Thank you very much, and good afternoon. I'm happy to be here on behalf of Blue Cross Blue Shield Association and our 38-member Blue Cross Blue Shield plans that represent 100 million members in every zip code across the country. And we're very concerned and interested in working with state policymakers as we're all facing the challenges ahead of us with regard to the health care reform law. And today, Deb and I were talking about this would be hopefully a good opportunity for an informational type of presentation to really discuss what all stakeholders are faced with right now in this uncertain time as the Affordable Care Act is being challenged, but as there are some pretty significant timelines that we are going to need to address in reaching some very important decisions. And I just realized, in terms of advancing, there we go. We do need to move along here. And I wanted to pick up on a comment from Consumer Checkbook with regard to the opportunities for states, because just as there are challenges for states, there are some opportunities. And I think some of the information that I just want to present today hopefully will highlight that, but there are some pretty important timelines with regard to those opportunities. So before we get to kind of the scenario what-ifs with regard to the Supreme Court decision that we anticipate at the end of June, wanted to provide a little bit of background as to just what the environment is right now. Because even though the law is being challenged, as you all know, there already are some reforms that have been put in place, and we continue, when I say we, whether it's state lawmakers themselves or whether it's the private sector, that we are needing to ramp up some programs to comply with the federal law. There are already some important reforms that have been put in place. As you recall, in September of 2010, there were some pretty basic reforms dealing with dependent age to 26 and a whole list. So those are already out there, and we're looking about the market reforms that will be put in place in 2014, new age rating bans from an insurance perspective, things like that. But from a timing point of view, looking at exchanges in the new marketplace, that is actually less than 18 months away. And as you're talking about, 25 years isn't that far away. Well, 18 months sure isn't far away at all. And today's Friday, late Wednesday afternoon, HHS just released some new materials for us all to consider with regard to the decisions that states have to make. Actually, they presented a blueprint for the kind of the declaration that states will need to make by 2013 as to whether they're going to be offering an exchange or what their intentions are. But the application to express your intent is actually due November 16th. So think about that. November 16th is when those declarations will come about.
Right,
of 2012, excuse me, yes, of this year. So, and as we all know, there are some states that have been moving forward. There are some that are really wanting to consider what the Supreme Court is going to be doing. Any variety, you are all aware of any variety of reasons that states are in varying positions with regard to where they're going to be on exchange development. Obviously, the elections play into this too. So, but what we also know is that what the law says and what HHS has been charged to do, they're underway. We have already seen any number of regulations, and as I say, we don't think there's enough in terms of rules that we need to know about this, but they are being churned out regularly. And so to them, any kind of failure with regard to the Affordable Care Act is not an option. They're moving forward. And as the release of new guidance just the other day indicates, if states aren't going to be acting on exchanges in some way, absolutely the federal government will be there to set up that exchange. So that's the scenario that we really are in today. So what I wanted to identify is, for states, regardless of kind of where a state might be in terms of the spectrum of deciding about exchanges, there are a very key objective from our perspective, and we believe from state officials' perspectives, is just the importance of the role in your state healthcare marketplace and in your insurance regulatory marketplace. That we believe that above all should be really a primary consideration, and that you all, as the state lawmakers and regulators in your state, need to understand the information that you need and the preparation that you need to have, both in terms of implementing the law, or if the law is not implemented in whole or in part, there are still going to be some very important decisions that do need to be made, and to be prepared for that happening just right around the corner. And there are, from the regulatory perspective, the NAIC is the National Association of Insurance Commissioners, the key regulators at the state level, are very well aware of this and are cranking out working groups and conference calls regularly to try from just the regulatory basis have that preparation underway. So really wanted to make you aware of that activity too. For states, you need to look at your own picture and environment and determine where you are with regard to what you all did with regard to the 2010 market reforms, what might you be planning for in terms of 2014 reforms, obviously where you are with regard to an exchange. And really key is the authority that you might be looking at in terms of planning, whether you need or already have put into place enabling legislation. Many sessions are already completed, whether there is the possibility or likelihood of a special session if some action needs to take place, the extent to which your state executive might be already has or might be contemplating executive order. Just to think about what the opportunities are for your state. The timelines, several critical timelines, as I indicated, in terms of when a state has to declare what they intend to do, and then after that, what needs to be done with, if you're moving forward with an exchange, the fall 2013 open enrollment period, and actually the January 1, 2014 implementation date. And absolutely critical is the need to coordinate among state officials, legislators, regulators, your administration, various other state agencies. I mean, obviously our perspective is primarily through the insurance regulators, but as we know, Medicaid, huge part of this of piece of the puzzle with regard to some of the functions, and the provider community and other health agencies within the states. Huge amount, and I can't overlook the IT function of this. It really is going to be supporting all of this. So again, a lot of you are aware of this, but from our perspective, these are some kind of assessments that a state needs to make, really, and hopefully already have that in place, but as we look toward the end of June, when the Affordable Care Act will be decided upon. And again, before we get to some scenarios, just wanted to provide a little bit more information about what we know where states are. And this was just a pretty simple chart regarding the 2010 reforms and where states were, because it actually, from a compliance point of view, it is of great assistance if a state, can go ahead and incorporate their law, because that way your regulators are really the first line of compliance and response with some of those reforms put into place. And I won't go into detail, but as you can see there, in most cases, at least the majority, if not the vast majority in the rate review, where we had to determine how effective our rate review process was, really did come forward on that. So the issue comes, though, these are in place. So when you look at the what-if scenario about if the law falls, what might you want to be doing about some of those? So we'll get to that in just a sec. One other thing, and I wanted to, this is kind of the new information that was provided in the guidance, and we talked about making sure that links to those would be available. I didn't have a chance to put the site on here, but I think CSG is going to make that available. But what we did get that we didn't have before was more information on the whole flexibility approach that HHS was claiming that they wanted to ensure that states, would be able to find the right niche for them to move forward on exchanges. And so what came forward yesterday was both the draft blueprint for looking at a state-based exchange, the state partnership exchange, where it's actually a federal approach, but where states are really maintaining a lot of the real key functions of an exchange. And even in the federally facilitated change, where it is absolutely the federal program, but there are still some important functions that it would be critical for states to retain, even in that scenario. So, again, I know that others at the back home are going to be really exploring these and determining where your state might best fit in, both from a resource perspective, any number of reasons that state officials are really evaluating where they might be on the exchange operation. So I wanted to provide this background. And one other thing I didn't have a chance to put on the slide either is that in this announcement there are going to be implementation forums that HHS will be conducting for state officials and for stakeholders to talk about and really explore all of these different options. But it's after June that they're set up, so we'll see how all this goes from there. But anyway, just to let you know, there are 4 regional ones in July 18th in D.C., August 2nd in Chicago, August 10th in Denver, and August 15th in Atlanta will be very major stakeholder forums. And again, that's part of the announcement that came out. So, and one last piece in terms of the critical functions where states really can retain control, whether, obviously in a state-based exchange, you really are retaining that completely. In a partnership or a federally facilitated, particularly in the partnership where a state really will have some opportunity to keep a good amount of control over the plan management functions. This is just a chart that we've come up with that has identified some of those key functions and really where states absolutely can be in the driver's seat with those. So just to identify, how extensive, even under the federal partnership, it really can be a state exchange. And from the partnership, one of the objectives of that is for states that might want to have control of their exchange but just are not ready yet. In other words, maybe in another year or 2 they will be there. A partnership really can be viewed as the transitional piece to get started but move to a state-based exchange down the road. But again, all that, who knows what might happen come the end of June. And so we wanted to just briefly look at the scenarios, and we've kind of been looking at it as five possibilities in terms of the entire law is upheld. Only the individual mandate is struck. That's that individuals must purchase insurance. What we think is a very critical piece is the individual mandate, but some of the reforms that were directly tied to that will make it an affordable and therefore accessible product, which are the guarantee issue and community rating pieces. Sometimes not necessarily popular pieces, but absolutely they go hand in hand with that mandate in order to get everyone in the pool and really address affordability. Then you have Title I can be struck, which was the exchange piece and kind of everything that goes with those market reforms, but that still leaves the Medicaid and a whole wealth of other, kitchen sink items that were part of the law, and then the entire bill getting struck. So without spending too much time on any of those, in terms of looking at what then, from a state preparation point of view, you might want to keep in mind under these various scenarios. 1, 2, or 3 scenarios basically are looking at all or some significant portion, significant from the exchange perspective, is upheld. And the thing of this is that even in this scenario with it all being upheld, you do need to be prepared then to act quickly because of the time frames so that you can states can still maintain some oversight. If a state doesn't do something in some of these key areas that we discussed, it really means that you will be sliding a lot of that authority over to the federal government and the impact that will have on some others. With regard to the insurance market reforms, that's where feds will then be there to oversee and address compliance issues with some pretty key market reforms. The plan management, that list chart of all the plan management functions, those are going to be the key rules of the exchange. And if states aren't prepared to step forward in some of those scenarios, all of that will be determined by HHS or CSIO. The agents, brokers, and navigators, how the exchange actually and the products on that are going to be marketed. For those, state legislators here with us, that's your agent and broker community that will going to be assisting the whole process, are going to be subject to federal rules rather than how you might want to address those in your state. The health plan choices. What we hope is that every single plan that meets the qualifications should be out there and be sold. As you were saying, you shouldn't be restricting those choices unnecessarily. In the initial guidance, it looked like the federal government, even under the federally facilitated exchange, might not be restricting that year one, but they absolutely would be reassessing that, and therefore they would be the ones potentially restricting the choices on exchanges. Just customer service generally. Under federally facilitated, if a state's not there to do that, there will be some 1-800 federal number to call. And then from just a jobs point of view, from the dollars of what a state's going to need to do, you're going to have those functions, but do you want the federal government to be doing that? And do you want the federal government to be assessing a state for some of those opportunities, but you don't have control over how those dollars are spent? These other scenarios in terms of striking the mandate, again, I mentioned it's so linked to guarantee issue that if they aren't continued to be linked, what you're going to see is skyrocketing prices if they are delinked. And even though it's probably the insurance industry or the federal government that will be bearing the brunt of that, obviously it's state officials that will be called upon to say, why is this happening in our state insurance marketplace? Scenario 4 about striking everything but Medicaid expansion. There are critical timelines and obvious budget issues with regard to that particular scenario of Medicaid still being out there and implemented. And then finally, with the law being substantially or completely overturned. As I said, there are a number of states that have, to varying degrees, implemented a lot of the state insurance reforms, and some of them are popular reforms. There are others, though, that the whole rest of the law isn't implemented as well, can pose some very interesting conflicts and controversies within the state insurance market. So it really will call very quickly for an assessment of what your marketplace looks like and how the state should fill in with progress toward health reforms that really will work. And I think even though Dr. Rowley didn't get to some of these, what we're looking for at the state level of where you can have some positive effect if the law, is not upheld, is overturned, it does open the door again to opportunities at the state level for looking at promoting informed consumer choices, getting information out there so that they can have good consumer choices, and especially flexibility and opportunity and incentives for payment system change, for delivery system change. I think if one thing the Affordable Care Act has done is really open our eyes to a wide number of opportunities through accountable care organizations and others, and there's some really good demo projects that even without the federal law, absolutely we in the private sector and the public sector can join together on some of those real opportunities. So the message is, be informed as to what is coming down the pike, not just a Supreme Court decision, but what all that means for you at the state level, and be prepared to move forward in the best way that really can benefit your health insurance marketplace and your constituents. So thank you very much.